Moving on, stakeholders in the health sector has attributed poor funding to the rising case of mother-to-child transmission of HIV/AIDS in Nigeria, while pointing out that the nation is 95% dependent on donor funding in its efforts to curb and effectively manage the spread of the killer disease. The stakeholders noted a sharp drop of drugs and other consumables, saying it will be important for Nigeria to take a leadership role in tackling the pandemic, as available statistics now places Nigeria as the second country with the highest burden of HIV in the world. Correspondent Linda Ike reports that the health stakeholders further harped on the need for concerted and collective efforts to fight the scourge of HIV/AIDS, stating that HIV is a condition that challenges everyone in the world, whether rich or poor. Speaking recently in a two-day media dialogue organized by UNICEF in collaboration with the Federal Ministry of Information and Culture, Assistant Director of Prevention of Mother-to-Child Transmission Department, Federal Ministry of Health, Dr. Gbenga Ijaudola, said Nigeria depends largely on donors to manage and control the spread of HIV/AIDS across the country, while 5% effort goes to government.
Woman's every child vision. That is, every woman give back to every child. Life direct. Child is ill and healthy. The mother is also ill and healthy. And the global strategy for women, children, and adolescents, we need what? Innovative, evidence-based approach to antenatal care. We will know. But for now, unfortunately, we are second. And we contribute by reflection of being second, by reflection of our population, because these are our statistics. We contributed the largest proportion of new infection for children.
Years, there has been only 30% HIV coverage around the country, adding that the coverage is far from the expected 90-90-90 global target. She, however, called on the leadership of Nigeria to map up plans on how to redesign so as to meet up with global standards, lamenting the gradual decline in global funding by donor agencies.
As you heard during the presentation, we're targeting about 90%, we're still about between 30 and 40%. So we've made some progress, but we're not quite there, and there's still a lot of work to be done. And this is especially important because we're looking at 2020, and when you look at a lot of states, a lot of countries, and Nigeria carries one of the largest burdens, so that they've left us behind and they're making a lot of progress. So the whole world is looking at us to see how we can really improve our own coverage so that the global targets can be met.
Olumide Osoyinpeju said there is an urgent need to ensure that every Nigerian child has access to basic service. He also emphasized the need for thorough follow-up on infected mothers to ensure adequate usage of prescribed medications, adding that most children are born with the virus due to misuse of prescribed drugs.
To engage community mobilizers and volunteers to educate women of reproductive age on the benefits of antenatal care and PMTCT services through facilitated community dialogues and position AFC, PMCTC clinics as trusted health centers for women. As journalists, you can use the medium at your disposal.
Going back to the previous report on the Al-Habibia Islamic Society.